Welcome to the Opioid Crisis in America Overview Training by the National Criminal Justice Training Center, with funding provided by the U.S. Department of Justice, Office of Community-Oriented Policing Services, COPS Office. This is the first of two modules that reviews opioids and discusses the opioid crisis. To complete this training, you must finish both modules in this series in their entirety. First, let's review how to navigate the course. To read along with the narration, select the Closed Captioning tab. If you encounter any unfamiliar terms in the training, select the Glossary tab. To view supporting documents, select the Resources tab. Let's get started. According to the U.S. Department of Health and Human Services, every day in America, 128 people die from an opioid overdose. This training is designed to help law enforcement officers and other criminal justice professionals understand and employ the appropriate actions and safety measures when responding to opioid-related events. Upon completing this module, you should be able to describe the difference between opiates and opioids, identify what opioids are used for, define the opioid epidemic, identify the symptoms of opioid withdrawal and opioid use, and describe the societal impact of opioid use. What's the difference between an opiate and an opioid? An opiate is a drug that is naturally derived from the flowering opium poppy plant. Examples of opiates include heroin, morphine, and codeine. The term opioid is a broader term that includes opiates and any other natural or synthetic substances that bind the brain's receptors, which are responsible for controlling pain. This includes oxycodone, methadone, and fentanyl, among many others. To learn more about the opium poppy plant, including how and where it is cultivated, review the Opium Poppy Plant document found within the Resources tab. When you're ready to continue, select the Continue button. Opiates have been used for thousands of years as a natural way to reduce pain, coughing, and diarrhea. More recently, opiates have been used to help people reduce their dependence on opioid medications and heroin. To help us understand more about how opioids are used in the medical field, let's have Dr. Stephen Brightly discuss common medical applications. Select the button shown here. When finished, select the Continue button.
Opioids can be used to reduce a person's dependence on opioid medications or heroin. Opioid maintenance medications include methadone, Suboxone, and Subutex. A patient may begin taking an opioid maintenance medication in place of heroin or a prescription opioid. Addiction and opioid use disorder are chronic diseases, and opioid maintenance treatment generally takes place for the indefinite long term. Opioids can be used to reduce a person's dependence on opioid medications or heroin. Opioid maintenance medications include methadone, Suboxone, and Subutex. A patient may begin taking an opioid maintenance medication in place of heroin or a prescription opioid. Addiction and opioid use disorder are chronic diseases, and opioid maintenance treatment generally takes place for the indefinite long term. Opioids help suppress coughs. If a patient is suffering with a lingering cough and over-the-counter medications are not working, the patient may be prescribed an opioid-based cough medicine by his or her physician. Opioids help suppress coughs. If a patient is suffering with a lingering cough and over-the-counter medications are not working, the patient may be prescribed an opioid-based cough medicine by his or her physician. Opioids can also be used to help people suffering from severe diarrhea. A patient may be prescribed an opioid-based diarrhea medication by a physician if he or she is unable to find relief using over-the-counter diarrhea medication. Note, however, that constipation is a common side effect for people addicted to opioids. When a person has a minor injury, that person's brain releases analgesic pain relievers called endorphins that help to naturally block the pain caused by the injury. Opioids mimic the action of endorphins when they activate and bind to opioid receptors located in the brain, spinal cord, and other organs of the body. It should be noted that opioids are generally more powerful than endorphins, so they trigger much stronger reactions. Opioids can be prescribed to help alleviate serious pain, ease end-of-life care, and treat acute, post-operative, and procedural pain. When a person has a minor injury, that person's brain releases analgesic pain relievers called endorphins that help to naturally block the pain caused by the injury. Opioids mimic the action of endorphins when they activate and bind to opioid receptors located in the brain, spinal cord, and other organs of the body. It should be noted that opioids are generally more powerful than endorphins, so they trigger much stronger reactions. Opioids can be prescribed to help alleviate serious pain, ease end-of-life care, and treat acute, post-operative, and procedural pain.
Take a moment to review some statistics about opioids that were reported by the White House Office of National Drug Control Policy. Use your mouse to drag and drop each answer on top to the corresponding information below. Then select the Submit button. As these staggering statistics suggest, the United States is in a drug abuse crisis. In 2018, drug overdoses continue to surpass car accidents as the leading cause of accidental deaths in the United States, with 46,802 of these accidents involving opioids. And since 2000, more than 440,000 Americans have died from overdoses involving opioids. Heroin is a highly addictive opioid that is illegal and has no accepted medical use in the United States. According to the National Survey on Drug Use and Health, about 886,000 Americans reported using heroin in 2017. From 2002 through 2016, the United States experienced a 135% increase in the number of heroin users and a staggering 533% increase in the number of deaths attributable to heroin. While some people may try heroin once and never use it again, there is a high probability that a large number of new users will become addicted. Heroin addiction is a process. As people's tolerance for the drug increases, they need more and more of the drug to reach the same high. Eventually, they may reach the point where they no longer get high, but they keep injecting simply to prevent withdrawal symptoms. Heroin is a serious public health and safety threat to the United States due to its abundant availability and its low price when compared to prescription opioid pills. The Drug Enforcement Administration, or DEA, reports that heroin use and overdose deaths have remained at high levels since 2015. Opioid painkillers are powerful medications with inherent risks, especially in cases of long-term use. With this in mind, more states are mandating the use of prescription drug monitoring programs. This in turn has led to a decrease in opioid prescriptions. On August 4, 2017, the DEA proposed reducing the more commonly prescribed Schedule II opioid painkillers manufactured in 2018 by 20% compared to 2017. This measure was intended to reduce the risk of prescription opioids diverting into illicit markets. Anytime supply exceeds demand, the excess supply is at greater risk of finding its way into the hands of illicit providers and users. Why are people using heroin? People start using heroin for a variety of reasons. For many people, it begins with using prescription painkillers after an injury or surgery. Select the play button to hear this woman's all-too-common story.
A few years ago, I got in a bad accident and was prescribed Vicodin to help with the pain. It was helpful at first, and I liked how it made me feel, but over time I needed more pills to feel normal. When 1 pill a day didn't work anymore, I started taking 2, and then 3. I eventually got up to 4 pills a day and was spending over $1,000 a month. I was running out of money, but I needed the pills or I'd start shaking and sweating and have to throw up. That's when I started using heroin. It was a lot cheaper and helped me avoid miserable withdrawals. Now I don't get a high anymore, but I inject every day just to stay well. A few years ago, if you told me that I'd become a heroin addict, I'd never believe you.
As the woman's story demonstrated, addictions can affect anyone. It's important to avoid long-term opioid use, which increases a person's tolerance to the drug as well as their dependence. What is considered long-term use? While this varies from person to person, an average of 10 to 14 days of constant opioid use will cause dependence. However, the chances of using opioids for 1 year or more increase substantially after 3 to 5 days of use. After this period, the person's body will require the medication to work and function normally. Without the drug, the person's body will go through severe withdrawals and become sick. Addicts refer to these withdrawal symptoms as dope sickness. People with opioid dependence experience severe withdrawal symptoms when they stop using opioids. As you read through these lists, you'll begin to understand why an addict will go to great lengths to avoid going through withdrawal. The list on the left includes terms used by addicts to describe their symptoms. The list on the right includes terms used by Harvard Medical School to describe opioid withdrawal. Note that the symptoms are largely the same, but the way they are described depends on the person or source describing them. When you've finished reviewing this information, select the Continue button. If people addicted to opioids decide to detox, they will experience physical withdrawal symptoms for an average of 7 to 10 days, according to the Substance Abuse and Mental Health Services Administration. These are 7 to 10 days of absolute misery before the opioids leave the system and the individual can be considered clean. Many addicts describe the detox process as the worst pain they've ever experienced and say that they never want to go through that pain again. Let's watch a video of two young men who describe their experience with heroin withdrawals.
The withdrawals are just, you feel like you're going to die.
Withdrawal is like the worst flu that you ever had, but times it by 100, I'd say.
You're sweating, then you're shivering, your eyes are watering, your skin is dry. My face would literally, it was like I was shedding a new face. Like all over, just completely dry skin.
You get the cold sweats, so you're freezing, and then you're also hot at the same time.
Your restless legs are the worst feeling in the world. The best way I can describe it is like, it's like your skin doesn't fit. Like you just want to like crawl out of your body.
You just want to literally jump out of your skin. You can't, there's nothing you can do to be comfortable. You could be lying in a bed with comfy pillows and that's not comfortable. You can't, you don't want to sit, you don't want to stand. When you're withdrawing, it's actually the one time that you don't have the energy to go and get high and use because all of your energy is deprived.
I didn't sleep for 7 days. I ate, I think maybe 3 or 4 times, like very small amount. Usually would end up throwing it back up. Couldn't get out of bed, but couldn't sit still. It was just the worst.
One of the worst withdrawal symptoms was constipation. You know, if I went on a week binge of doing it, I wouldn't go to the bathroom, number 2, at all in that week. And you don't realize that, I mean, that's terrible. I mean, that's really bad for your body. So when you finally come off of it, you want to go to the bathroom, but it's almost like you're just all plugged up. You can't go. Was the most excruciating pain.
All I can say is I would not wish that on my worst enemy ever. Like if you can't think of any reason not to do heroin, like think of that.
A lot of times you go through withdrawal and you start to feel a little bit better. You're coming out of the withdrawal and you say, you know, every heroin addict's been there where they say, all right, I'm done. I'm never going through this again. And then, you know, a couple days goes by and you start feeling better and you feel back to normal and you just forget how bad it feels.
Despite going through a miserable withdrawal period, opioid addicts have a high chance of relapsing. In one study published in the Irish Medical Journal, 99 out of 109 patients experienced a relapse. That's 91%. Within 1 week of being discharged from the detox program,
the withdrawals are just, you feel like you're going to die.
Withdrawal is like the worst flu that you ever had, but times it by 100, I'd say.
You're sweating, then you're...
Despite going through a miserable withdrawal period, Opioid addicts have a high chance of relapsing. In one study published in the Irish Medical Journal, 99 out of 109 patients experienced a relapse. That's 91%. Within 1 week of being discharged from the detox program, 64% had relapsed. Within 1 month of being discharged, the proportion had risen to 80%. Staying free from opioids is a lifelong journey for former addicts. An increasingly common problem in the United States is neonatal abstinence syndrome, which occurs when babies are born dependent on opioids or other drugs. When an opioid addict learns she is pregnant, the natural tendency is to get off the drug in order to protect her baby. However, there is a high possibility that the fetus will not survive the detox process in the womb. As a result, physicians often inform the pregnant mother that she cannot quit. Instead, the physician may direct the pregnant mother to take an opioid such as methadone, which is a daily medication, so she can carry the baby to full term. The problem with taking opioids during pregnancy is that upon birth, the baby is dependent on opioids and must go through withdrawals. In 2012, nearly 22,000 babies were born drug-dependent, one every 25 minutes, according to the Centers for Disease Control and Prevention. Let's take a moment to watch a video about physicians, nurses, and other medical staff who detox babies off of their opioid addictions.
A quiet epidemic on the rise where roughly 1 baby an hour in this country is born hooked on prescription painkillers their mothers are abusing. These innocent victims face an uphill battle, as we saw when we were invited into one special hospital ward in Tennessee. ABC's Juju Chang brings us this tale of hope and heartbreak as part of our division-wide commitment to telling the stories of the invisible among us, a hidden America.
It's noon in the neonatal intensive care unit at East Tennessee Children's Hospital, and baby Grayson, just 48 hours old, is shaking again.
He's tremoring and that.
Grayson was born with a serious drug dependency because his pregnant mother was addicted to painkillers. Now he gets morphine every 3 hours to cut the pain of withdrawal. Grayson was brought here from a nearby hospital to this special unit for detoxing newborns. Right now, there are 23 tiny patients here going through withdrawal, mostly from prescription pills like OxyContin, Vicodin, or Percocet.
It's like they're inconsolable. I know people probably think I exaggerate when I say they have this very fearful look in their eyes. Well, they do. Good morning.
Carla Saunders is the head nurse of this special unit.
They'll have really bad tremors, really bad jitters, very bad irritability, vomiting, diarrhea, stomach cramping.
Nightline was given rare access for 4 days and nights to witness firsthand what they see as a new and hidden epidemic in this country, striking the most innocent of victims.
At Cabell Huntington Hospital, 1 out of every 5 babies delivered has been exposed to drugs before they were born.
We are a 15-bed unit, and today we have 18. Last week we had 26.
Sarah Murray helped create a unit specifically for these newborns.
You're keeping this place dim for the baby's sake.
Yes, we try to keep a low stimulus environment. That means we keep the lights low and we keep the unit as quiet as possible.
Babies here go through withdrawal for drugs like painkillers and heroin, and more often these days, other substances being cut into the heroin supply, like fentanyl and the anti-seizure medication gabapentin.
It's just devastating for these babies. Neurological symptoms that we had never seen before, we're seeing now, and they have rapid eye movements, just different than anything I've ever seen. They roll down, they roll up, back and forth, and they tongue thrust. I mean, they're thrusting their tongue all the time, and they're very uncomfortable.
Now let's take a look at what often happens to individuals when they are under the influence of an opioid. What are some indicators to look for? Let's listen in as Jennifer, a registered nurse familiar with opioid addiction and the associated physiological responses, outlines these symptoms. Select each of the buttons shown here. When finished, select the Continue button.
People using opioids often get extremely sleepy. Opioid users may tell you that all they want to do is sleep. When a person is on the nod, they may actually fall asleep as you ask them questions or while they're in the middle of a sentence. People under the influence of opioids often have constricted pupils. Pupil size can be checked with a pupillometer card. The normal range of pupils is 3 millimeters to 6.5 millimeters in diameter. When a person is using opioids, his or her pupils will likely be under 3 millimeters in diameter.